The bag technique. It is a tool by which the nurse, during her visit, will enable her to perform a nursing procedure with ease and deftness, to save time and effort, with the end view of rendering effective nursing care to clients. The public health bag is an essential and indispensable equipment of a public health nurse which she has to carry along during her home visits. It contains basic medications and articles which are necessary for giving care. Principles of bag technique. Number 1. Performing the bag technique will minimize, if not prevent, the spread of any infection. Number 2. It saves time and effort in the performance of nursing procedures. Number 3. The bag technique should show the effectiveness of total care to an individual or family. The last, number 4, the bag technique can be performed in a variety of ways depending on the agency's policy, the home situation, or as long as principles of avoiding transfer of infection are always observed. Steps in performing the bag technique actions. Upon arrival at the patient's home, place the bag on the table lined with a clean paper. The clean side must be out and the folded part touching the table. Rationale for that, to protect the bag from getting contaminated. Ask for a basin of water or a glass of drinking water if tap water is not available. Rationale, to be used for hand washing. Open the bag and take out the towel and soap. Rationale, to prepare for hand washing. Wash hands using soap and water and then wipe to dry. Rationale, to prevent infection from the care provider to the client. Put out all the necessary articles needed for the specific care. Rationale, to have them readily accessible. Close the bag and put it in one corner of the working area. Rationale, to prevent contamination. Take out the apron from the bag and put it on with the right side out. Rationale, to protect the nurse's uniform. Proceed in performing the necessary nursing care and treatment. Rationale, to give comfort and security and hasten recovery. After giving the treatment, clean all things that were used and perform hand washing or use alcohol. Rationale, to protect the caregiver and prevent infection. Open the bag and return all things that were used in their proper places after cleaning them. Rationale, to protect the caregiver and prevent infection. Remove apron, folding it away from the person, the soiled side in and the clean side out. Place it in the bag. Take the record and have a talk with the mother. Write down all the necessary data that were gathered, observations, nursing care and treatment rendered. Give instructions for care of patients in the absence of the nurse. Rationale for reference in the next visit. Make appointment for the next visit, either home or clinic, taking note of the date and time. Rationale for follow-up care. Fold the lining, place it inside the bag, and close the bag.